come in. Hi, Brian. Thank you for joining. If you know anyone that's interested in sickle cell, please ping them in. And we will continue to wait one moment. Hello, Dr. Rao. Thank you for joining us. Um, okay, I think we
Hi, good
will.
evening.
Hello.
Just wanted to introduce myself. I'm Anselm. I'm an internist. I practice currently in Virginia, and I'm willing to help and ready to whatever there is, anything, any topic related to whatever, any comorbidities or even disease like sickle cell disease. I'd love to be part of anything that can help with. That's all. Send back myself to the audience. Just wanted to introduce myself.
Okay. Thank you. It's nice to meet
Thank
you.
you.
Um, okay, we'll go ahead and get started, and people will start to come, I think, as we get going. So, thank you everyone for joining. Tonight, we are here with Dr. Cynthia Hall. She is a pharmacist working in sickle cell innovation. And we are talking tonight about sickle cell. As you know, sickle cell impacts a vulnerable population. And according to the CDC, 1 out of every 500 Black Americans is affected by sickle cell anemia. That sickled hemoglobin cell, it can cause severe pain, which can lead to potential organ damage. It can even cause death if not treated. And Cynthia Hall has come up with an amazing way to reach people. She's created a comic book series, and they're called the Crescent City Chronicles. She started this series in 2007, and I believe she published in 2019. So, this has been a project of hers that she has had quite a bit of passion for since her time volunteering at the Sickle Cell Foundation of Georgia. So, thank you so much, Dr. Cynthia Hall, for joining us. I know this is your first time speaking on Clubhouse, so welcome. And we look forward to this conversation. I've been very excited since you agreed to join. So I'd like to hand it over to you just to give us an intro, explain your whys to the audience.
Okay, well, thank you so much for inviting me. Um, I began my journey advocating for patients with sickle cell disease, as Tia said, through the Sickle Cell Foundation of Georgia. And that occurred around 2005. And at the time, I was working as a retail pharmacist, and one of my uh, pharmacy coworkers, she has the sickle cell trait. And her father, who was a patient of mine, has the disease. And I was looking for some disease state related nonprofits to volunteer for. And the Sickle Cell Foundation of Georgia was one of three that I eventually uh, volunteered for. But my connection with this particular organization has really affected the rest of my life and even today. I am a strong advocate for people living with sickle cell disease. And during my time at the foundation, I was able to connect them with the art school located here in Atlanta. And an artist was able to help me start this journey of a comic book dealing with sickle cell, where people from the community are actually the superheroes in the comic, but the comics cover things such as healthy eating, the importance of immunization, specifically getting a flu shot every year, also just good general health practices for patients with sickle cell disease. And I've completed 3 books so far, but I have 3 more coming. Um, and so, yeah, so I'm here today to talk to you all about the disease state, about the comics, my perspectives on the comics, and why I think they're important. And yeah, So I'm open to our discussion.
Thank you so much for the intro. If you pull to refresh, you'll see I've added your three comics in my profile picture. And shortly I'll tag that in the top of the room so that people can link and see your creations. So um, again, there's so many things to start to talk about. There's so many obstacles. Let's start with one of the main obstacles that people face, and that is just treatment, just basic treatment, because we're having this opioid crisis with people that don't necessarily need the opioids, but there are people out there that actually really rely on these drugs for quality of life. And many of those people have sickle cell. Can you kind of walk us through, Dr. Hall, how that plays into the patient's everyday life?
Okay. Well, with opioid use, that is a standard treatment for vaso-occlusive crisis that occurs with sickle cell disease. Um, and prior to the epidemic, the opioid epidemic, patients generally had issues trying to get these medications. And as a pharmacist, I saw that. Um, so generally, with the patients, they need large amounts of the medications. They develop tolerance and other effects that require large dosages, large amounts to be taken periodically. And so as I said, before the epidemic, they had issues. So you can imagine now how things are. Um, and often when the patients are presenting into the healthcare system, it may be the emergency room. And I think some of the doctors are on the line and they can attest to this. And not all emergency room doctors are familiar with the disease, familiar with the disease state, know that the patient will generally know which medications work for their pain, will be comfortable in giving them the large doses that they may need. Um, Often they're seen as problematic patients, possibly because of the pain that they're going through and um, how they've been treated before in the healthcare system, basically. So that is one of the major obstacles, one of the major issues involving sickle cell disease.
And what are the typical comorbidities that go along with having sickle cell? Are there often other diseases that make these patients more vulnerable as well?
Well, with sickle cell disease, um, it's a disease where the hemoglobin, genetically, the hemoglobin is different from normal. It's a sickle trait of some sort. And because of that, you can just imagine hemoglobin is what transports oxygen all over the body, every organ you can think of. So comorbidities are potentially many, and they can be devastating, and they can um, lead to a decreased longevity, decreased lifespan. So you can have things such as a, a, acute chest syndrome, where there's difficulty breathing that can lead to death, osteoporosis, just everything, any disease, chronic disease that you can think of. It's just compounded with sickle cell, in sickle cell.
Yeah, I can see how that would be a difficult patient for doctors when you have so many comorbidities, and it's maybe difficult to pinpoint where
Mhm.
the issue is. Do you have sickle cell or know anyone in your family with sickle cell? Are you personally impacted by this?
Actually, I'm not, surprisingly, but my if I can remember back when I first um, knew of the disease, it was when I was in high school, and my father was a science teacher at another high school, and um, there was a guy over there, and my dad was like, okay, well, he has sickle cell, so it's not like we were going to date or anything like that, but I guess he really wanted to let me know up front. But he said that it totally went in one ear and out the other because I had no, I knew nothing of it basically. And so when I did get to college, there was a young lady who was in my residence hall, and she was sick a lot. And I saw her and her suffering, her inability to go to classes, to really participate in anything collegiate. And she eventually did leave the university. So that's when I really saw it. And of course, in pharmacy school, um, we did learn about sickle cell, the disease state, the drugs that are used to treat it. Um, and so I learned more uh, during that time. So when I got out of school and started practicing and um, was intimately, um, affected, I wasn't affected, but one of my coworkers was, as I um, expressed. And when I got into the organization, the community based organization that help patients with sickle cell in the community, I, it just really tugged at me, and I just had to continue my path, including the disease state.
And that organization is the Sickle Cell Foundation of Georgia. Is that where you originally
It,
volunteered?
yes, that is where I originally volunteered.
And do children mostly get diagnosed with sickle cell? Is it rare to make it past childhood and not know you have it? Are there symptoms?
It's not rare anymore because there are there's a national program for newborn screening that's done now. But I could just tell you a story of one of the ladies at the Sickle Cell Foundation of Georgia. She did have sickle cell, and she was sick often, and she really suffered. And she said that she was not diagnosed until she was about 18, and she would go in and out of the hospital. She's probably in her 50s. So this was before newborn screening really took a hold, and people could find out at the child's birth. So this was before that occurred. And so she would have these pain crises, and nobody really could tell her what caused it or anything like that. And so she, like I said, she got diagnosed when she was 18, but she had had frequent visits to the ER prior to that diagnosis.
Oh, wow. Yeah, I think I would think that the later the diagnosis, the more damage the disease could do without treatment.
Mhm.
Um,
Yes, yes, absolutely. And with treatment, blood transfusions was one of the things that was like that they would utilize, especially in the ER, back when she was going to the hospital frequently. Um, so the treatments are now coming into fruition for sickle cell, and that is another disparity of the disease state, in that there wasn't much research done in sickle cell until really recently, as far as medications coming um, and being approved. So there is hope. There is hope, everybody.
and can you give us kind of a high level explanation of what would a treatment do for sickle cell? How would it impact these sickled shaped hemoglobins?
Okay, well, the goal is to decrease the amount of red blood cells uh, that are sickling. Uh, so some of the medications that are out there now, they that is their mechanism of action. So to decrease that to a certain percentage, the person can actually present as not having the disease, but more of having the traits. So meaning there'll be less consequences, less effects of the disease.
Oh, wow. Okay. I didn't know. I didn't know that they could present as not
Yeah.
positive for sickle. That's great.
Yes.
Um, and so I'll ask one more question before I open it up to the audience. And hi, Sophie. Thank you for joining. Sophie is our co-mod today. Um, I know before we started the room, we were talking a little bit about just the vulnerability of this population and a lot of the obstacles that they are seeing just getting regular treatment. So, could
Mhm.
you kind of give us a little bit more of a background on that and what makes them vulnerable and why is it difficult for them to seek this treatment?
Okay. So I would like everybody to know that not only am I a pharmacist, but I'm a lawyer and an ethicist. I do have ethics training, and it is with the ethics training that I received that it really became clear to me how, as you say, vulnerable this specific patient population is within the healthcare system. And they're vulnerable because not only because they're African American patients that primarily have this disease, but it's a disease that needs a treatment that has been declared in a crisis, an epidemic, the opioid epidemic. So uh, that puts them in a place of if the provider is unaware of the disease in general, then the patient will have poor care and poor outcomes. There's really no way around it unless, and that's where I come in, others come in to educate the public, the providers, and others about the disease state. Um, yeah.
And what are some of the ways that you've found successful in educating the population?
If you could repeat that one more time.
What ways have you found that are successful in helping to provide education to the sickle cell population?
Okay. Well, with with the comic books, actually, I have had community book based organizations purchase the books for hospitals, actually, and the hospitals have distributed these to um, patients, and they have enjoyed it. I've had feedback from parents um, of of children with sickle cell, and they they really love the comics because it kind of reinforces things that the patient should do. So at a young age, they can see, hey, in a fun way, I should eat better, and this is what better eating looks like. Um, I can, I should get a flu shot, and because I did get a flu shot, maybe I can participate in some events at school, which is what my second comic book depicts. And then with the third comic book, it really covers the fact that patients with sickle cell need to stay hydrated. Um, they need to rest. Uh, they don't need to overexert themselves and decrease their stress levels. So, with the comic books and reinforcing these things that, yeah, providers may tell them, their parents may tell them, it really allows the patient to put themselves or see themselves in a way that they may relate to differently or better. than what has been presented to them.
I love it. I love the whole idea. And I wonder, you did say flu shot, so it's going to bring up this question. What about COVID? What are the kiddos doing with COVID now? Are they at more risk?
They are more at risk, and anytime there's a immunization that, let's say, a high priority disease state would need, sickle cell is right there as far as a patient population needing that. So with COVID, of course, they are at risk. And I think I saw somewhere today that with the new therapies, um, having certain disease states uh, makes this drug indicated, and sickle cell was right there. Yes.
Okay, yeah, it's good to know. It's good to know. I'm going to do a really quick reset. You are in the MedStarter Healthcare Innovator space. You can follow us by clicking on the greenhouse. Tonight we are joined by guest Dr. Cynthia Hall. She's a sickle cell advocate and works in the innovation space. And we have Sophie as our co-mod. Hi, Sophie. And I will pass it to you, Sophie, to give a question or brief introduction if you have.
Hi, thanks, Taya. Hi, Cynthia. It's so nice to meet you virtually. I've been looking forward to today for a while. I love this idea of spreading awareness about sickle cell anemia and the disorder, and all of the comorbidities and everything that comes with it, especially for children, in a fun way that's easy for laymen and for children and relatives and everyone to understand. I think that's a great initiative. Maybe you said this before because I joined the room a little bit late, but I was really wondering what inspired you? Why specifically sickle cell anemia? And what inspired you? What gave you the idea to start with comic books as opposed to um, presentations, or as opposed to you know um, talking to kids in hospitals or things like that? Why this particular avenue, and why sickle cell?
Okay. Well, my volunteering for the Sickle Cell Foundation of Georgia is where I first got interested broadly, generally in sickle cell. Now, there was an art school um, that I connected the organization with to potentially produce T-shirts, actually, for their summer camp, for their walk. And the gentleman at this art school was in a was a sequential art professor, director. And so I asked him, what is sequential art? And he was telling me, well, it's comic books. And that is when the light bulb moment went off. And I was like, oh, well, we're already working on some T-shirts, a T-shirt design through your students. Do you have any students that might be willing or want to do some type of superhero comic book um, for patients with sickle cell? And I was able to connect with really one of his best students at the time. And he was uh, in on part one and part two. And he completed his part before he graduated. And then he went off to work for DC Comics and Marvel, and he was just that good.
Wow.
And so yeah, that's how that all started. It wasn't a grand idea of mine. It was basically just living life, having
Wow. No,
interactions with
that's
people.
that's how things happen, right? I think God
Absolutely.
puts the right people together and makes
Mhm.
things happen, and we just have to stay open. how would
Mhm.
you otherwise have met him, right? And I think,
Exactly.
yeah, I'm sorry if you answered this question before or talked about it earlier, but I
Mhm.
was so curious that I really needed to know how you got on this pathway. It's a great idea.
Mhm. Yes. And subsequently after that, I called the art school back and they hooked me up with one of their alumni and she joined. And yeah, so it's been great as far as that relationship is concerned.
Thank you so much. I'd like to pass it now to Maru. Maru, did you have a question or comment for Dr. Hall?
Thank you, Tia. Hi, Sophie. Hey, Doc, Cynthia. I
Okay.
love the comics. I just briefly glanced at them
Mhm.
on your website, and they look amazing. So you've done a great job bringing this to light. I am in awe. Great job.
Oh, thank you so much for that. I really appreciate it. It was a labor of love. And I was telling Tia beforehand that I began these back in 2007, but didn't complete them until 10 years later, um, while I was an assistant professor at Florida A&M University's College of Pharmacy. Uh, and partly that was because, there's tenure involved when you're a professor and art or creative works pretty much count. And so that really um, caused me to reignite my passion to complete these because I don't know if you know, but when you're an artist and you're creative and you're putting something out, you always kind of second guess yourself, like, would people really want to see this? Would these really make an impact? And so when you're forced to do it, um, and then you put it out and then you suddenly have great feedback and it's motivating. So yes, it was a long time coming.
I think all creatives can relate to that. I totally can relate to that feeling, but I think this is such an important, um, it's innovative. It's such an important innovation to provide children with these kind of resources. Um, uh, let's move on to Dr. D. Dr. Darlene, did you have a question or comment for Dr. Hall?
Yes, hi, Dr. Holt. I'm Dr. Darlene Abbey. I work at the Defense Health Agency at Martin Army Community Hospital on the Fort Benning military
Oh,
base. And
okay.
I'm so excited that you're doing this topic. I lost a really good friend. I think I was about 17 or 18, and he passed from sickle cell. And
Mhm,
my question to you is, I come from a community, my parents are from Haiti, and sometimes it's a little difficult to, um, you know, it's difficult for us to be vulnerable about our health.
mhm.
How can we better serve, our population, our community, and bringing awareness to them, those that are kind of scared and don't really trust easy and really believe that they can kind of help their own child? How can we, present your material to them and assist them to be a little bit more receptive to the research and what's going on?
Okay, well, what I've done is I really try to put these books in the language of the community and of the children who may be reading it. So there's not a lot of um, talk that will go over a person's head. It's situational. Uh, like one situation is is the whole book. Like for instance, with the flu shots. So it's about having sickle cell patients, go to their community pharmacy and their community pharmacist to get a flu shot. And so the background of this particular story is a a girl in high school who wants to be in the winter play. And so she's worried about it. And she has a friend, another friend who has sickle cell. And that friend is encouraging her, well, as a wellness measure, you should try to, you should go ahead and get a flu shot and maybe that'll be helpful. So, how I depict it is the pharmacist is actually the superhero um, in that book. Her name is Dr. Yolanda Landry. Uh, the book series is based in New Orleans, which is called the Crescent City. So it's the Crescent City Chronicles, and it's a high school that has my three main characters go to this high school, and they encourage each other. And so in this particular one, she ends up getting the lead in the play, A Streetcar Named Desire, which is based in New Orleans. Um, and in the end, she is able to perform because she was worried about that and second guessing herself and um, wanting her understudy to understand that, hey, you might have to come and perform for me. So, it gets kind of like a true to life type, how someone might think. And then, of course, they always triumph in the end in my books. So that's just a different way of letting them know, letting others know what may be going on with the patient. And one thing I did want to note is when was showing this to one of my students uh, back at the college, she was like, can you do one for patients with ADHD? She's like, because I'm really tired of having to explain um, why I sometimes do the things I do or what's actually going on with me. And she was like, something like this is would be really meaningful because um, it kind of makes a person feel special. Is what she basically said. So I guess it's like a decreasing of the stigma when people are able to understand what someone else is going through.
Yeah, exactly. It's about inclusion, right? You feel included.
Yes,
You see
absolutely.
something that you relate to personally. I
Hmm.
can definitely see this in other areas, like you mentioned ADHD. That would be great. But there's many diseases. We were talking a little bit earlier about. I have a cousin that has lupus, and it would be a great thing to have a comic book series on lupus as well. She definitely deals with some of the pain issues as well, having lupus. So it's really interesting. Oh, thank you, Sheree, for joining us. Did you have a question or comment for Dr. Hall?
Yes, I do. Thank you, Taya, for the invitation. And Cynthia, I really love what you're doing with the comic series. I'm getting a red bar. Hopefully, you all can still hear me. Um, but I absolutely love the approach, and I love that you stated that the city that one of the comics is in Crescent, Louisiana. That's very creative. But my question is, I have a friend that's in Nigeria, and I've been to Nigeria several times in the last 3 years, and just kind of experiencing firsthand the lack of resources there. His brother suffers from sickle cell, and I kind of want to be able to give them some um, possibly things that they can do probably on the natural side of things. So I wanted to know if there was anything that you would suggest um, for for people who don't have the resources that we do here. I know earlier you had mentioned diet. Is there anything else in particular that would be helpful for people of lack of resources?
Okay, that is an excellent question and not an area that I really know too much about. So I kind of have to stick with diet at this point and basically eating things high in folic acid or folate, staying away from preservatives, sweeteners, um, those type of items. And also being properly hydrated, that's a big thing. That helps with the hemoglobin and um, not having a highly viscous blood, having highly viscous blood to help in that regard. Now, there are some other natural things that I really can't speak on that some people feel can help relieve pain, if you know what I'm talking about.
Yeah,
but
I think I got a little idea there. I'm a firm believer in holistic healing. I
mhm.
follow closely with Dr. Sebi, if you're familiar with him.
Yes.
He's been arguably um, a doctor that practices herbal medicine and natural remedies for diseases and have cured a lot of diseases with his approach. So I know exactly where you're going. But so I'll pass those pointers out to them, to the family, so they're aware to stay on top of his diet and make sure he's staying well hydrated. Thank you so very much.
No problem at
Mm,
all. And another thing that I'd like to add that's extremely important also is they can't patients can't get too hot or too cold because that can make a crisis occur also. So I did want to just add that too.
Thank you. Thank you.
thank you.
It's so funny because being over there a few times, I got heat rashes because it in if you've been in any country in Africa, it is literally a different kind of heat. Like it's the sun is right over your head. Like there is no
Wow.
distance, it feels like. And he would often stay cold. He would be cold
Mm,
all the time. And
mm,
so it's funny that you said that. And they tried to keep, they couldn't go to the mall often. They would have to leave, you know, pretty soon after getting there because, of course, being inside, it's colder
mhm, right.
than being outside. So thank you.
Oh, you're welcome. And another thing I'd like to interject is the fact that sickle cell doesn't present the same in all patients. So there could be some who suffer a lot, and then others that can walk around normally um, and do normal things. And but again, with treatment and taking care of yourself, um, it is something that can be managed, and hopefully, it'll go the way of chronic diseases such as HIV, even though it's not related, where it becomes a more chronic disease where people might have a normal length of living, hopefully, with taking care of themselves and treatments.
Thank you, Sheree, and thank you, Dr. Hall, for your response. I think, Sheree, you bring up a good point of, not all areas of the world are maybe the same in access to treatments. Dr. Hall, what are some ways we can advocate not only here in the US, but for others? Just advocate for education of sickle cell, advocate for resources. Do you have some ideas for us? I've also tagged the Sickle Cell Foundation of Georgia above if anyone wants to check that out for information.
Okay. Well, it's funny you mentioned that because I just saw an article on LinkedIn. Uh, it was presented by a law firm, but it was they were interviewing Dr. Taylor. Um, and what I'll do is I'll send that to you because he just gave an excellent overview and really a master class, in my opinion, um, of all aspects of sickle cell and how people should advocate now, what the current issues are as far as being a great advocate for sickle cell disease. So, if you don't mind, I'd like to give you that link, and maybe you can give that link to others. But basically, he was stating that funding is necessary. Um, Generally, NIH funding had gone down for sickle cell in the recent past, but it's ramping back up. Actually, there were many comprehensive sickle cell centers, and those went away because there was a focus more on research than clinical care. And that was a mistake that was made years ago. And so the focus uh, was off of the patient and their day to day life and um, their treatment, and it focused on research instead. So I think that is reversing now, but there needs to be some advocacy in that area. Again, he's at Howard University, which is an historically Black university in Washington, D.C. And he's the director of their Comprehensive Sickle Cell Center, and he gave some great notes for advocating for sickle cell disease because it is the largest rare disease. And to give you some context, uh, there are probably approximately 100,000 patients or people living with sickle cell. That's generally the CDC statistics on that. Whereas with cystic fibrosis, which is an inherited disease also, there's like 33,000 patients in the US, but the funding is vastly different for a variety of reasons. And he really delves into that. So if anyone is interested, I would definitely say to check him out. And yes, I'll give you that link, Tia.
Okay, thank you. And that's
Mm-hmm.
Dr. Taylor at Howard University.
Mm-hmm.
Okay. Yeah, send me the link and I will tag it in LinkedIn when I write the thank you post. And I'll tag
Okay.
everyone that was in the room tonight. Are
Okay.
there any more questions for Dr. Hall?
I have one more question. Dr.
Okay.
Hall, you mentioned that people had asked whether you might be able to write a comic book for other um, disorders or illnesses that are poorly understood. Um, I think you mentioned ADHD, and I was really interested in that, especially our mental health. You know, our mental illness is something that carries a stigma, even today, difficult to explain because there are sometimes no physical um, signs or symptoms, and it's very difficult to explain what the person is going through. I feel like that's another area which could really benefit from this.
Yes, I absolutely agree. So
I
definitely,
love
I'm always
diverse, and you know the style of drawing, it's, yeah, it's not the typical, it's almost, it kind of a nod to anime, I want to say. um
I think so. Yes.
Yeah, and I think that will capture a certain audience. You know, younger people kind of automatically gravitate towards that style of illustration. I think that's kind of genius. So I wondered from you, what is the next comic book series you think you might write? Which direction do you think you might go?
Okay. Well, haven't really thought of that. Uh, but yeah, like you said, mental health is something that's stigmatized, just like sickle cell, and I think that would probably be a natural progression. Um, Now, with this series that I'm currently doing, I do have three other parts, as I mentioned, that I want to crank out. And in the end, I eventually want to uh, put it into a graphic novel, actually. So, um, but yeah, mental health definitely is an area of interest. And I think you're right. It would really be amenable to a comic book type style as far as raising awareness and decreasing the stigma of it because of how it's presented. So thank you for that.
Thank you.
Mhm.
Thank you. Sophia, cutting in a little bit in and out there for a minute, but I think we answered your question.
Yes, sorry about that. Can you hear me now?
Yes, yes, we can.
Excellent. Thank you so much, Dr. Hall. Yes, you answered my question perfectly, and I'm really encouraged. I'm really curious to find out what you're going to do next.
Okay, great.
Thank you so much, Dr. Cynthia Hall. And before we leave today, are there any innovations or any news you would like us to keep an eye out on for sickle cell? Anything exciting that you feel is coming?
Um, well, just stay tuned. I can't really speak too much on it, but I do have hope in what I've been seeing as far as potential treatments for patients with sickle cell disease. So hopefully, within the next few years, this conversation could could go differently, and a lot of the issues that the patients now face, uh, they won't have to face because they have therapies and treatments that will help.
And if someone is a patient and they're interested in clinical research, is there a site that they can go to? Would they just reach out to the Sickle Cell Foundation of Georgia for those opportunities?
Well, I believe within NIH there is um, a part of NIH that really deals specifically with African Americans um, in research, in biomedical research. But I'm sorry, I don't have the name. I can look that up for you, and I can have that for you when you send out the other information to everyone on the call.
Okay, yeah, sure. I can add that. So I think that's a whole other layer that we really didn't have a chance to dive into is just the research aspect of sickle cell and being able to reach the population and make them feel safe in, participating in a research trial. I think, uh, we did mention they're a vulnerable population, and a lot of that um, vulnerability is because there are not enough research trials geared toward this population. But at the same time, there is a distrust in the population. They may not necessarily want to join the clinical research trial. So
Correct, very correct.
yeah, so definitely increasing that conversation and education on both sides is important.
Yes, very.
So yeah, I'd love to share anything that you have about research when I post this. So thank you again, Dr. Cynthia Hall. If there's no further questions, I will um, close out the room. But how can everyone follow you on social media, Dr. Hall? I know you're not commonly on Clubhouse. This is your first room. So what
Yes.
are other ways that they can follow you?
I'm on LinkedIn only for now, but yeah, so definitely everyone who's interested, just connect with me on LinkedIn. It's going to be Cynthia Renee Hall, and PharmD JDMS is what that title would be.
Okay, great. And I will link your book as well when I
Okay.
post on LinkedIn. But this has been a really great conversation, and I love what you're doing. I think it's just amazing um, bringing these topics to readers in a fun way. I just love it. So thank you so much, Dr. Hall.
Thank you. And thank you for having me, and thank you for everyone who's participated and listened in. Thank you.
Thank you.
Excellent.
And I will send out the link to the replays, and you can share now with people not even on Clubhouse, so anyone can listen to this. Thank you. Sophie?
Fabulous. Thank you so much, both of you. Really enjoyed it.
All right. Thanks.
Okay, thank you. I will close the room in
All right. Have a good
3,
night.
2, 1.
Good
Goodbye.
night.
Good night.